Hello, my dear friends. Dr.MedEx Indian Medical Society is going to focus on medicine, surgery, PSM, OBGY, biochemistry. Let's begin our MCQ classes. The first question of today's class is yes. Which agency promotes the health awareness in India? Yes, please tell me. Which one? Yes, C. Central Health Education Bureau. Okay. Why not A? Because A focuses on health intelligence in statistics and data collection, not awareness. Why not B? ICMR? Because ICMR conducts medical research, not public health promotion. Okay. Why not D? Why not D? It is National Medical Library. It manages medical literature and libraries. Come to the question second. Most popular fertility indicator among the following is yes. Which one? Total fertility rate. Okay. Total fertility rate. Here, come to this box and you will get more information for this question. Net reproduction rate, that is NRR, GFR, and this is total birth rate, that is TFR, and this one is CBR, crude birth rate per 1000, total birth rate 15 to 49 summed into 5, and GFR, general fertility rate, birth per 1000 women is between 15 to 49. NRR, net reproduction rate, girl children per woman accounting for mortality. Come to the questions third. Very easy question. Question third is very easy question. Which of the following vitamins increases iron absorption? Vitamin C. You know about it. Vitamins serve as a cofactor. Vitamins serves as a cofactor for numerous enzymes. B1 is known as thiamine, and cofactor of B1 is TPP. What is TPP? Thiamine pyrophosphate. And enzyme examples pyruvate dehydrogenase and transcriptolase. What is vitamin B2? That is riboflavin. Riboflavin. Okay. What is cofactor? FMN. Example: acyl CoA dehydrogenase, succinate dehydrogenase. B3 niacin. B3 niacin, NAD plus NADP plus. Lactate dehydrogenase, HMGA CO reductase. Vitamin B3. What is vitamin B5? Pantothenic acid. Pantothenic acid. Okay, pantothenic acid. Coenzyme A. Okay. And enzyme examples: acetyl coenzyme A carboxylase. Come to vitamin B6. Vitamin B6. That is pyridoxine. Vitamin B6 is pyridoxine. What is coenzyme pyridoxine? PLP. PLP. That is pyridoxal phosphate. What is the example? Pyridoxal phosphate aminotransferase or glycogen phosphorylase. Come to the vitamin B7, that is biotin. Vitamin B7 is biotin. What is the cofactor of biotin? that is biocytine. Biocytine. Okay. Example, pyruvate carboxylase, acetyl coenzyme A carboxylase. What is vitamin B12? Cobalamin. Okay, cobalamin. That is methyl cobalamin and methionine synthase and methylmalonyl coenzyme A mutase. Vitamin C, that is ascorbic acid. Okay. So cofactor is ascorbate. Ascorbate. Example is prolyl hydroxylase, dopamine beta hydroxylase. Come to the question number 4. Question number 4. What is referred to as demographic bonus? What is referred to as demographic bonus? Option? Yes, please tell me A, B, C, D. Yes. What is the answer? Answer is B. Increase in productive age population. Increase in productive age population. Demographic bonus, or we can also say dividend, referred to as economic growth potential when the working age population, typically 15 to 64 years, exceeds the dependent population, children under 15 and elderly over 65, creating a higher worker to dependent ratio that boosts productivity and GDP. Come to the question number 5. Which kind of shock causes an increase in the central venous pressure? Which kind of shock? Okay. Neurogenic, hypovolemic, anaphylactic, cardiogenic. Which one? Yes, cardiogenic. Why? Why cardiogenic? Central venous pressure increases in cardiogenic shock due to impaired cardiac pumping, causing blood to back up into the venous system and elevate right atrial pressure. What is the normal CVP? The normal CVP is equal to 0 to 6 mmHg. Okay, mmHg. CVP by shock type. Okay, you will get more information from this table. CVP by shock type, types of shock, CVP level and region. In neurogenic shock. In neurogenic shock, CVP level decreases. CVP level decreases. Okay. CVP level decreases. In hypovolemic shock, CVP level decreases. Okay. In anaphylactic shock, CVP level decreases. But in cardiogenic shock, CVP level increases. Why? Because pump failure backs up venous pressure. In anaphylactic shock, vasodilation and capillary leak. Hypovolemic shock, CVP level decreases. Low intravascular volume and vasodilation reduces venous return. Okay. Come to the question number 6. A 29-year-old postpartum lactating mother presents with redness and pain. The image is shown below. What is the most likely diagnosis? What is the most likely diagnosis? Tell me. Fibroadenoma, breast abscess, phyllodes and breast cancer. I think it's breast abscess, B. Okay. Breast abscess is a pus-filled collection. Breast abscess is a pus-filled collection. Pus-filled collections often complicating mastitis. It typically presents as a painful erythematous lump. Painful also is painful. Erythematous rash, erythematous lump with possible fluctuance, fever, systemic symptoms, most common in lactating women, but also seen in non-lactational cases. Common organism is Staphylococcus aureus. Staphylococcus aureus. It is seen in lactating females. Diagnosis is done by the ultrasound. Antibiotic of choice is amoxicillin plus clavulanic acid. Come to the question number 7. Question number 7. Yes. Which of the following drugs decreases mortality in patient with heart failure? Okay. Which one? A is furosemide, B is metoprolol, C is prazosin, D is torsemide. What is metoprolol? Decreases mortality in patient with heart failure. Why others don't? Why others option don't? Drug, class, effect on mortality. Furosemide, what is class? Loop diuretics. Furosemide, loop diuretics. Okay. What is the effect on mortality? Symptomatic relief only, no mortality benefit. Metoprolol is beta blocker. Metoprolol is beta blocker. Decreases approximate 34 to 35% of all cause mortality. All cause mortality. Okay. Prazosin alpha blocker. No mortality benefit. No mortality benefit. Okay. Come to the option D, torsemide. Torsemide is also loop diuretics. Better bioavailability than furosemide, but no proven mortality reduction. Okay. Come to the question number 8. Come to the question number 8. Question number 8. A 70-year-old male cancer patient is on the chemotherapy. He developed neutropenia after chemotherapy treatment. Which of the following drugs is used to increase the immunity in this patient? We have to increase the immunity of this patient because this patient is suffering from cancer. So, which medicine is very much beneficial for this patient? Filgrastim, darbepoetin, option C, or oprelvecin, option D is iron dextran. Which one is the answer? Option A. To increase the immunity of this patient. Okay, increase the immunity of this patient. Okay, I'm telling to you the next question. Question number 9. Okay, question number 9. Come to the question number 8. I will explain you a few important things. Question number 8. Okay. Filgrastim is the answer of this question. Okay. Come to the question number 9. Which nerve involved in the Frey syndrome? Which nerve involved in the Frey syndrome? That is facial nerve, oculomotor nerve, or auriculotemporal nerve, glossopharyngeal nerve. Yes, please tell me. Answer is auriculotemporal nerve. Okay, auriculotemporal nerve. Frey syndrome, that is gustatory sweatings. In Frey syndromes, there is gustatory sweatings occurs due to aberrant regeneration of auriculotemporal nerve fibers post peritidectomy. Okay, Frey syndrome causes gustatory sweatings. Frey syndrome causes gustatory sweating. Okay, and flushing. Flushing. Flushing due to the aberrant regeneration after parotid gland surgery. After parotid gland surgery on the or trauma in which parasympathetic fibers from auriculotemporal nerve auriculotemporal nerve, okay, a branch of the trigeminal nerve, trigeminal nerve, a branch of the trigeminal nerves, mandibular division, misconnect with the sympathetic fibers to sweat glands. You can see here auriculotemporal nerve, auriculotemporal nerve, is parotid gland, auriculotemporal nerve, sweat glands. Okay, this is aortic ganglion, tympanic nerve of Jacobson, that is glossopharyngeal nerve, inferior salivary nebulous veins. Come to the last question for today. Question number 10. The type of knot seen in the image, this image, type of knot seen in the image. What is the answer? That is half hitch knot, no. Surgeon's knot, no. Crossed half hitch knot, no. That is reef knot. Types of surgical knot. This is if there is a square like this, then this is a square knot. This is granny knot. One is up, one is down, granny knot. This is up, this is up, this is down, this is both threads are down, up, up. Then this is square knot, the granny knot. This is surgeon's knot. Okay, this is surgeon's knot. So today we finished our class here. Thank you very much. Thank you very much for attending this class. We will continue tomorrow. I will prepare few questions and again prepare for you people and upload it in the YouTube channel. Thank you very much. Have a nice time. Bye bye.